What does it feel like to have Hashimoto's disease? This is a common question that I'm often asked by people who suspect they have Hashimoto's or people who've recently been diagnosed and want to know what to expect down the road or in the future. I'm Dr. Hagmeyer, and in today's video, I'm going to try to answer this question as well as provide a better understanding of what's really happening and going on inside your body. You see, Hashimoto's thyroiditis is an autoimmune disease that over time destroys thyroid tissue and causes permanent hypothyroidism. Hashimoto's thyroiditis is the most common cause of hypothyroidism in the United States, and it is the most common autoimmune disease among women. Some sources will actually say that Hashimoto's is 10 times more prevalent among women than it is men. And most women are usually diagnosed between the ages of 35 and 50 years old. Now, if you've been taking thyroid medication for Hashimoto's, please understand that regardless of the medication that you are currently taking and being prescribed, that this medication really only provides you with hormones while the immune system continues to slowly destroy your gland. A mistake that many people make is the false assumption that by taking some sort of thyroid hormone replacement, that they won't have Hashimoto's disease or it won't get any worse. But again, this is a huge misunderstanding. Today's video, for those of you who are new to this adventure, I want to review with you what it's like to have this flare up and explain what happens in the beginning versus the late stages of this disease. And if you watch this video to the end, I'm going to share with you one thing lurking around your kitchen spice rack that you probably cook with every single day that you want to stop using. Now, first, it's important to understand that Hashimoto's disease is a problem with the immune system. I say this over and over again. The problem is not the thyroid. So really, any treatment that doesn't address the immune system and really only focuses on the thyroid hormone levels is not going to fix or stop the damage that's being done to your thyroid gland. Now, each person who has Hashimoto's has a unique experience. Some people with Hashimoto's may struggle with a roller coaster of symptoms for a very, very long time, while others may tell you that they have symptoms of hyperthyroidism for a few years before they became permanently hypothyroid. So keep in mind that in the beginning stages of a Hashimoto's flare-up, you may feel and experience those symptoms of hyperthyroidism. But again, much of this depends on how well you take care of yourself and where you are in the progression of this disease, as well as how long you've had this. In the later stages of Hashimoto's disease, most of what you're going to feel are the hypothyroid symptoms. So again, the early stages and during a flare-up, you're going to experience more of those hyperthyroid symptoms. And those are going to be symptoms like heart palpitations, like feeling nauseous, hair falling out, diarrhea, anxiety, inward trembling. Again, other symptoms include joints that feel more achy than usual. Maybe your thyroid feels swollen and it becomes a bit harder to swallow. Maybe you go to your doctor and they find out that you have a goiter, which again is just an enlarged thyroid gland. Then you may go through a period where you feel normal, and perhaps I dare say that you actually feel good, thinking that your problem is gone. Unfortunately, this feeling of feeling good doesn't last very long. Your immune system gets fired up again, and now you're back on this roller coaster. And that's the red flag for me, or the clue that I think about when I'm testing someone or think about testing somebody for Hashimoto's. With Hashimoto's disease, it's a roller coaster of symptoms fluctuating between hyper and hypo. And again, the problem with this is that at the time, you can either be over-medicated or under-medicated, which further intensifies and worsens these symptoms. You see, when the immune system attack slows down, this is where you might feel a little bit better, or you feel more hypothyroid. Maybe you start feeling fatigued physically. You don't want to get off the couch. Your muscles ache. You have muscle weakness. Instead of losing weight when you're hyperthyroid, now you're starting to gain weight just looking at food. Once upon a time, you couldn't fall asleep because your mind was racing and it was go, 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 and you felt on edge. Now you can't seem to get enough sleep. It's hard for you to drag yourself out of bed or start your day without a few cups of coffee. Maybe the diarrhea that you had changed to more now constipation and bloating and abdominal pain. Maybe you're having a hard time just getting motivated or staying focused on a task. Maybe you're a bit scatterbrained. You're forgetting things that you would have never forgotten in the past a couple months ago. Again, this is by no means an exhaustive list of what it feels like to have Hashimoto's or for you to experience a flare-up, but you should be on the lookout for these symptoms that are bouncing back and forth between hyper and hypothyroidism. In traditional medicine, doctors or endocrinologists focus entirely on thyroid medication like Synthroid or levothyroxine. If your TSH is elevated, they increase your Synthroid or levothyroxine, and when your TSH drops or gets low, they decrease your synthroid or levothyroxine. But this is really a recipe for disaster because the root cause of the problem is still being ignored. The problem with this practice is that it's so much more complex than just playing around with increasing and decreasing thyroid medications based on TSH levels. The two biggest problems that this is for doctors is forgetting that the symptoms are really the result of thyroid damage or thyroid destruction. And what I mean by that is when your immune system destroys a part of the thyroid gland, your thyroid hormones, T3 and T4, leak into the bloodstream, and this is where some of the hyperthyroid symptoms show up. Now here's the problem for many of you. If you're already taking synthroid or levothyroxine or some other thyroid medication, on top of these hormones that you're getting from the outside, your thyroid is leaking more of these hormones into the bloodstream. So this is where you become over-medicated. This is also where those hyperthyroid symptoms show up and really intensify. Now, if you stumbled upon this video and you haven't been officially diagnosed with Hashimoto's yet, but you can relate to many of these different symptoms of hyper and hypo, the waxing and the waning of these symptoms, you should absolutely 100% get tested. Now, the good news is that these days, if your doctor won't test you or won't run a comprehensive thyroid panel for you, which includes all of the tests that I'm going to list here, you can order all of these tests on your own. And if that's something that you want to do, I will leave a link in the description box. Now, in the beginning of this video, I told you that if you hung around to the end, that there was one thing I promised that you probably cook with on a daily basis that you're going to want to give up. Maybe you already know this, maybe you don't, but the one thing you want to give up is salt. Not the kind of sea salt that you might be using, but the iodized salt. And here's why. Iodized salt in a number of studies have been shown to increase antibodies in Hashimoto's disease. The way we identify Hashimoto's in patients is by running two tests that look at antibodies against their thyroid. One of those antibodies is TPO, and if you're using salt or taking iodine supplementation thinking that it's going to help your thyroid, you could be unknowingly causing more tissue damage. So as I wrap up today's video, if you like today's video, make sure you give it a thumbs up. If you want to learn more about working with my clinic and how I work with patients who have thyroid problems or Hashimoto's, I'll leave some links in the description box. I'll also leave some links to other articles that I've written, other videos that I've done that pertain to Hashimoto's that I think you're going to enjoy. Now, if you have questions about Hashimoto's, drop me a comment or a question below, and I'll do my best to answer those questions for you. Now I want to hear from you. From your perspective, what's been your experience with Hashimoto's disease? How long has it been since you've had Hashimoto's? What's been your experience with the symptoms over the years? Have you also noticed a waxing and waning of symptoms that I mentioned? How often did you experience the hyperthyroid symptoms before your immune system made you permanently hypothyroid? There's a lot of people out there who are wondering these questions and want to know what to expect. So I'm Dr. Hagmeyer. I hope you learned a few things in this video, and we'll see you next time.